Fantastic. And you can hear me okay?
Yes, we can hear you well.
Okay, and I shall start sharing my screen. And would like to say many thanks for the introduction and for asking me to present a talk. It's very good to see some familiar faces, people I've worked with in the UK previously, so that's very nice. Yes, so what would I like to talk about today? A bit my experiences, a bit about maybe my journey, and also sharing some top tips with you. So as Rona was saying, I'm now based, I used to live in the UK for many years, and I'm now saying hello from Germany to all. So I'm based in northern Germany in a research institution here. What would I like to talk about? A bit about my journey, some placement experiences and what they could lead to in terms of research. And then I'd like to share some reflection on this and some top tips as well for all of you who are maybe looking to start a placement or who have already worked a bit with practice and are maybe hoping to extend this and so forth. And I'm here as well in the afternoon or like in the next hour if there are any questions. Bit about my background. So I'm a psychologist by background. I studied in the Netherlands, my bachelor's, then came to the UK to study health psychology. And actually, as part of this master course, we were already doing a placement. It was a 4-month placement that we were asked to do. And where I spent my placement was at Bristol City Council. Actually in the local, so at the city council, at the local authority level, and I was part of the transport and planning department. Maybe this will raise some questions about, okay, what does this have to do with health? I'm sure it's obvious to you, transport and health are very much linked, especially if we think about health and all policies, health in all departments, we need to think about health also when planning. So of particular focus in part of that placement was cycling as a topic. So there was a big interest in cycling for health. Bristol was also England's first kind of cycling city. However, certain groups of the population were not found to be cycling. There were a lot of questions about, you know, whether people are actually able to cycle, whether they have the kind of on their attitudes and the norms around cycling. So as part of this placement, I then got involved in kind of 2 research projects that came from local practice. One of them was to kind of figure out attitudes and norms, was to undertake a content analysis of actually newspaper articles in Bristol and some other cities to explore attitudes towards cycling as an activity and also cyclists as kind of people involved in the activity. And this was done with the colleagues in public health practice there. And yeah, we were working on this together. A second kind of research project that came from it was a literature review on the so-called safety in numbers hypothesis, which kind of states that the more people cycle, the safer it is for each and everyone who's engaged in the activity. So we were looking at the evidence-based, international evidence-based around this hypothesis. So this placement, it was a 4-month placement as part of my master's, and to remind you, I studied psychology, so this was a very much kind of opened my eye towards what public health actually meant. We did learn about it in class, but here I was able to see it kind of firsthand, and it really opened my eye as to what public health meant, what kind of activities were involved, what topics maybe were concerns, maybe which department, so even the transport department is looking into health topics, and also the different people and organizations and structures of public health. This placement also in kind of retrospect, thinking about it, provided me with an insight into the work at a local authority, addressing kind of the local topics, needs, demands, and also the circumstances, which is very important. And it enabled me to get insight into the local structures as well, existing partnerships, possibly available data sources that are held at the local level, as well as the responsibilities of public health in the different sectors. And last but not least, it provided a topic for my master dissertation, which I wrote about this content analysis. So this placement at the end of my studies really made me eager to continue research and to work in public health. And this then led me to apply for a research assistant position at Bristol University in the Center for Public Health under Rona's guidance and leadership. And this is what I started to do afterwards. So this is what I guess would be called now the pre-doctoral fellow. So I was one of those, as Rona introduced me in the beginning, and back in 2012, quite a few years ago now. And this position was jointly funded by the NIHR, SPHR, as well as one of the centers of excellence in public health, the Decipher Center. As part of this position, I was in total involved in over 20 different research projects. Of course, not conducting every project from start to finish, but kind of supporting, engaged in different methodologies. So undertaking qualitative interviews, doing data collection, analyzing data, doing systematic reviews, meta-analysis of many different topics, many different methodologies. It also provided me with a really strong kind of research training. Because I was obviously at the beginning of my career stage. So this kind of research training was what I felt was also very important in terms of quantitative, qualitative methods, research governance, and so forth. So I attended in the 2-year time frame over 11 courses in this. It also, really gave me further development with regard to just other core academic skills, such as presenting research at conferences, talking about research, also teaching, getting to know the peer review process, writing funding grants, and so forth, and also involvement, of course, in publications. But I'm here today to talk about actual experiences of public health. I've mentioned the placement at the start. However, I would now like to point out to 2 further examples of how questions raised at practice level can lead to research work and further work down the line, let's say. Bit of background about the first project. So I was line managed by Dr. Ruth Kipping, who at that time, when I was line managed by her, actually had a role as a public health consultant in local authority, as well as a research role. So she was very well connected to the public health practice at a local level. And one of the things that she was part of was, as a public health consultant, was the so-called child death panel review meetings that she attended, I think, every quarter, where those are meetings in public health practice where every death of a child gets reviewed to examine whether this could have been prevented. And at one of those local meetings, a panel member raised the question, or raised that she has heard that the so-called choking game was played in schools in Bristol. The choking game, just to explain what that means, was it's not a game, it's a so-called game about where children would find to self-strangulate or strangulate one another by hands, for instance, to achieve a brief euphoric state caused by cerebral hypoxia, so a brief high, let's say. Obviously, I do have to say as well that this activity is dangerous and it can also be fatal. However, this was raised at one of those local meetings, and we then, or the panel members then asked the question, well, what do we actually know about this game? Is this common? Is this played elsewhere? And how dangerous is it? Is it something we need to do something about? So this question raised at a local level then led to a systematic review on the topic that was undertaken in collaboration, and it ended up in my first author publication, which I guess is always a celebration to have a first author publication in the journal Archives of Disease in Childhood. And there was a lot of follow-on work that stemmed from this systematic reviews. There was an editorial written about this. I still receive peer review requests regarding this topic, having done the systematic review. I've been in contact with other support groups or other individuals, also internationally, who've been affected by the topic, and some of them who've lost their child because of this, and ended up in multiple conference presentations and so forth. And not only that, it also provided me with experience of dealing with fairly sensitive topics. So this was obviously something we would not want to tell everyone about, because there is a potential danger that then people might start Googling it, and possibly young people starting to engage in it just because it sounds interesting. So also that experience was very helpful, and all came from this one question asked at a local level and brought up at this local level. So this is one of the examples. The other examples I would like to point out is that in Bristol, actually, we were approached by a local, well, coordinators of a local mentoring program. They were called Breakthrough Mentoring in Bristol. And the question that came to us as an institution and to Rona initially, and then we were concerned about this question was, well, is our program actually effective? Like, we've been running this for 10 years. How do we know whether it's actually beneficial to the young people, and can it improve their health and well-being as we hope it would, and the educational outcomes, or what's the evidence about this? So they were very keen to find out what's the evidence around this mentoring program. So collaboratively, we used the FES scheme and applied for funding to do a feasibility study, which I was also heavily involved in about this. So again, another example how a question raised from practitioners from the local area led to a research project. So this gives you some overview of what I've been doing as part of the pre-doctoral fellow and the questions that were raised at local levels. So you might wonder, well, what happened to me afterwards, let's say. I found the topic of mentoring so interesting that I undertook a PhD in this, supervised by Rona and Ruth and others. So this investigated the use of mentoring programs, and this came from this research project. And since last year and onwards, I've applied for a research position here at the Leibniz Institute, and I'm a scientist here. And I actually here am the head of the Applied Intervention Research Unit. We are around 15 people concerned about all topics intervention research, everything development of interventions, evaluation, implementation. Some of the topics we addressed are shown here, such as physical activity, mental health, and so forth. And we actually, as part of the team, which I find particularly, I guess, relevant to today's session, is that we have nutritionists as well. So they are not research staff, but practitioner staff who have had collaborations with local daycare centers, nurseries for over 20 years in terms of sharing current research findings in nutrition and translating that directly into the practices at daycare centers. And so it's some that I found very relevant, I guess. And we also have a very close connection to the local public health practice and practitioners here in Bremen. It's quite a small state, and a lot of organizations involved. And also, yeah, we use this for our research, because I guess when I'm thinking about interventions, I need to think about, well, how are they sustainable? I need to make sure they fit to the local structures and to the local context so that they can be continued past their kind of research focus if proven effective, and that they just integrate well into the existing local structures. And this can only happen, I guess, by closely working with people in public health practice to see, you know, the sustainability of things, the doability, the feasibility of things, and so forth. Okay, I'm coming to the last bit. How do I think this work and the practice placements shape my career? Initially, it got me excited about public health in general, because I was studying psychology and then doing this practice placement. So for me personally, it has a huge relevance. It really helped me to gain insight into the real world. And I think this is such a benefit as well of the NIHR SPHR school focusing on the practice placement, because it's a kind of eye-opener sometimes and lets us to leave our silos and engage and understand structures, local context, circumstances, and also priorities, timelines, and maybe also ways of working in local public health, and to understand the questions that are of priority for the local level. It further can possibly enable long-term connections and collaborations with local public health partners, which, you know, you might find helpful for your research further down the line, and for raising up for bringing up new research projects. And it further enabled me as well to share ideas, sharing expertise. I mean, we all have different expertise, and I think only by bringing it together, we can really work with the best, let's say. And yeah, this practice placements also made me realize that sharing expertise and knowledge is crucial, particularly in the field of public health. So in fact, I would actually argue that engaging with practice will also provide better public health. I think maybe it's a clear statement, but I cannot emphasize it enough, I guess, that I think to really make a change, we need to have collaborations, and the collaborative efforts are needed. And I think this is also being shown with the current pandemic, that working together, sharing resources, combining this expertise enhances the likelihood for achieving positive health outcomes. And we know that many topics in public health are complex. So tackling this cannot be done in isolation. We would need to work together to target big topics such as physical activity, mental health, and so forth. So I think knowledge of what's happening in public health practice can really help inform and shape research, and vice versa, ensuring that research is relevant. It's important to understand the local public health systems and partners and structures to get to know what might work and what might not work at all. And it can also help you further, as it did in my case at least, develop my own research interests and research ideas, and to foster collaborations, long-term collaborations. There might be some challenges you might face, such as, keeping track of time if you're involved in different projects. It's possibly also a new way of communicating research findings, which I think is also an important skill to gain. And I guess some of the challenges might also be different timelines and so forth in practice. I mean, ideally, we have the answer to a question tomorrow, whereas in research, we know it might take a little bit longer to find the answer. So kind of navigating around this will also become important. Top tips for you, and please feel free to ask me questions. I'd encourage you to be open, be curious once you're on placement, ask the questions you want to ask, get involved, show interest, approach colleagues and ask for maybe further shadowing opportunities, to get involved in different type of meetings, different type of boards, to really understand the structures. Possibly, if there's a chance, to look past your individual unit and team members to understand those broader structures. So to get involved in a diversity of activities and topics, if that's possible. And to, networking never be I think, done enough. So you never know who you might meet at a virtual get-together or a coffee hour or an event. I know it's all virtual at the moment, but as the previous speaker has already, said, ask questions in the chat, write emails to know those contacts. And maybe last but not least, also to be patient. We all speak a different language, and also maybe public health practitioners, when you're there on your first day, you might get confronted with lots of acronyms and a slightly different language. Be patient, you will learn the language, and you will also learn how to better communicate maybe your language, your research language possibly, to local public health practitioners to make this work. So many thanks for your attention. I'm very happy to have any questions, and thank you once more. Yeah.